Yeah, so basically, today, unfortunately, is a sad milestone where we have our 300th patient with COVID that has gone in the ICU since March. Right now, we have two patients who are admitted to the ICU but are sitting in our emergency department who have nowhere to go. So our ICU is full, and our critical care physician has been trying to transfer this patient to, or one of the patients to another hospital, and he's unable to. He said he's been speaking with Hamilton to try to transfer a patient to Hamilton. So I'm in Scarborough, which is the east end of Toronto, and the closest hospital he can find is Hamilton. And he said that our patients in the emergency department are too unstable, so they're trying to see if there's a patient in the ICU who's stable enough to transfer instead.
Tell me about the place that puts doctors in when they're being told to make, quote, difficult choices. You know, who gets care and who doesn't, who gets a bed and who will be left out. And what you're hearing, just anecdotally, from your colleagues.
So right now we're not at that point where we're making those kind of decisions. I'm really scared that in the near future we may be at that point where we'll have to make those decisions. Right now, everybody's working really hard to really try to juggle patients, move them around. I can tell you that our charge nurses in our emergency department, unfortunately, are spending their entire shifts trying to move patients and transport them out of hospital. And everyone is working really hard to discharge patients, move patients from the emergency department up to the wards or the ICU. So we're all really working hard on top of giving exemplary care to our patients. We're also working hard trying to find space for them.
Dr. Lisa Salamon, I know it's busy. We're going to let you get back to it, but thank you so much for joining us again today to get that message out there. So important.
Great. Thanks for having me.